Hi, my name's Ray Owen. I'm a clinical psychologist. I work mostly for the NHS in Herefordshire in the UK, where I specialise in physical health. Most of my work's actually in cancer and palliative care, and that's what I've done for most of my career. This is a brief narrated PowerPoint presentation on acceptance and commitment therapy, ACT. And it is a brief overview. Its main purpose is for those who either have done perhaps an introductory training some time ago, want to refresh their memory before going on to look further at the subject, or maybe you're about to do a training and would just like a quick look across the topic that might sort of prime them, familiarise them with some of the concepts before they begin. Acceptance and commitment therapy, often abbreviated to ACT but never pronounced as ACT, is sometimes referred to as one of the third wave of behavioural and cognitive psychotherapies, alongside other approaches such as dialectical behaviour therapy, the mindfulness-based approaches, mindfulness-based stress reduction, mindfulness-based cognitive therapy, and also compassion-focused therapy, though some would disagree whether it belongs in quite the same category. The historical background of ACT involves a range of people. The name most associated with its initial development is Professor Steve Hayes, alongside his colleagues Kelly Wilson and Kirk Stroessel, who's not shown here. But a whole range of other people you will come across, Robin Moser, Russ Harris, Johan Dahl, representing the big Norwegian Scandinavian influence on the development of ACT, and Kevin Polk here, who has worked a lot on an alternative way of presenting it to the one that you'll be hearing about today. Worth pointing out that quite a few of these people had a background in radical behaviourism, applied behaviour analysis, fundamental learning processes. That's going to become relevant. The starter position for ACT is a rejection of the concepts endorsed by many of our cultures of healthy, happy normality. The idea that this is the default state of a human being, and any deviation from it is a sign that something is wrong. The reality that many of us encounter is people experiencing that they're not healthy and or they're not happy. So by that other assumption, they would therefore regard themselves as being not normal. And that doesn't fit with reality as most of us experience it. The major reason to suspect that that's false is simply the ubiquity of human suffering. The single most remarkable fact about human existence is how hard it is for humans to be happy. It was one of the lines from the initial major ACT book by Hayes, Stroessel and Wilson. There's all sorts of ways we could describe that widespread nature of human suffering. The high lifetime incidence of the big diagnoses one may make under DSM or other diagnostic criteria, if that's a way that you work. The fact that there's all sorts of needs for treatment and support from people who might not fit into those mental health categories. The fact that out there's high rates of divorce, sexual concerns, abuse, violence, prejudice, and that some extremely destructive behaviours are both common and aren't necessarily attached to some sort of syndrome. The most extreme example, I guess, being suicide. So what's the alternative assumption? Well, the alternative assumption is what's sometimes referred to as destructive normality. The idea that normal psychological processes that are working in the way that they're meant to often are destructive. And we need to understand these processes and work within them to promote health, whether that's physical health or psychological health. The culprit, according to ACT, is the system of normal mental representation and processing, which we, within this approach, often refer to more generally as language. And underpinning that, some basic learning processes, and one particular approach to that that's known as relational frame theory. Okay, go back to those fundamental learning processes. Functional contextualism is the underpinning philosophy, if you like, of acceptance and commitment therapy. This states that we can't understand, respond, or be helpful about a behaviour without knowing something about the context it occurs in and its functional consequence. The behaviour itself doesn't tell us anything of use. And within that approach, some of you may well be familiar with this, we tend to talk about ABCs, antecedents, behaviours and consequences, an approach very familiar from fundamental learning theory and applied behaviour analysis. This is of course a development of Skinner's approach of radical behaviourism. Here's an example. Someone might experience feelings of anxiety and sadness, have thoughts like "I'm a loser, life sucks." They might be surrounded by environmental factors like a TV in front of them, a fridge full of beer nearby, and being alone. Those would, in this way of working, be described as the antecedents. And they were the antecedents to the target behaviour. The behaviour in question being the person trying not to think about it, watching TV and drinking large quantities of beer until he falls asleep, drunk. The consequences of that behaviour in the short term may well be relief from painful thoughts and feelings. Those would be the maintaining consequences. That would be why the behaviour was more likely to occur, because in the short term there was relief from those painful thoughts and feelings. However, in the long term, obviously it may lead to damage to physical health, increasing the emotional pain further. Relational frame theory is the model for how that kind of learning occurs in humans, how those relationships between objects, items in a person's world build up in the human mind during development and education and lead to a system of symbolic mental representation which we call language. In learning more about ACT, it's going to be really worth learning more about relational frame theory. However, that's as much detail I want to go into for now. So the development of ACT really started, there's a lot of development work during the 1990s, but most of the work has been since Steve Hayes and his colleagues published their original book on acceptance and commitment therapy in 1999. Since that time, it's been applied across a huge range of problems and settings, and the list that's here is only a small subset. This is a scientific approach, often led by people with a good research background, and therefore carefully evidencing the process has been very important. To date, there's well over 100 randomised controlled trials, as well as many hundreds smaller studies and case studies. There's been within that an emphasis on what's called mediational analysis, not just checking that there is a good outcome to the whole intervention, but checking that that outcome seems to be mediated by changes to the processes we think we're changing in ACT. There have been some problems with the evidence base, some of it from a couple of critical systematic reviews and meta-analyses, though some of that criticism may well come down to a fundamental difference in opinion about the relevance of diagnoses as a way of classifying participants, which is not something that happens within ACT and its related cousins. There's more recently been criticism that many of these studies aren't against what we call a strong control. For example, skilled cognitive behaviour therapy. Many of them are against waiting list controls, which is perhaps not unusual for a relatively young approach. However, that is an important factor. When a study is run against a very active control like skilled CBT, what we tend to find is similar efficacy. It would be wrong to claim that there is evidence of systematic superiority of ACT over second wave Beck Podesky style cognitive therapy, but equally the studies that have been done suggest that it is no less effective than that. Almost all of the available research and the evidence is available at this website, contextualscience.org, which is the online home of ACT and its related approaches. It's also worth briefly noticing that ACT has been accepted onto many of the evidence-based practice lists that develop, particularly in the States, where there is strong research support, particularly for its use in chronic pain. not a specific topic we're going into today. Okay, so the basic model of ACT suggests that a whole set of processes get in the way of people living a fulfilled life, get them stuck. The 6 core ones that we tend to talk about, when you lay 6 of them down on a piece of paper, you tend to get them in a sort of hexagon form. And those areas of difficulty, or those processes that lead to difficulty, tend to be labelled in this way, that there is experiential avoidance. That's where we base our actions on avoiding feeling bad. There's fusion, where we get tangled up in thoughts. There's loss of contact with the present moment, where we tend to get caught up in the past and the future. There's the tendency to develop an inflexible sense of self, where we get stuck in an unhelpful story about ourselves. Perhaps most importantly, there's a loss of contact with values, not recognising what matters to us in life, and a lack of committed action, not living effectively, rather not acting effectively in order to live life the way you want to, in accordance with those values. Let's take those in sequence first. On the left-hand side, the experiential avoidance, which is dealing with unwanted feelings, and the fusion, which is dealing with unwanted thoughts. So those difficult thoughts, we're trying to move people from a fused sense. Fused means losing the distinction between thought and reality, seeing the world through that thought rather than the world as it actually is. And moving from that to a defused position, where the person notices thoughts as thoughts and then chooses the response that best suits them. As for the unwanted feelings, we're trying to move people from experiential avoidance, where we base our actions on avoiding feeling bad, even if that leads to more trouble in the long term. So that, in the example we had before, would be drinking and falling asleep in order to stop yourself having sad feelings, even though that was leading to more problems in the long term. Moving from that experiential avoidance to acceptance or willingness to experience, allowing whatever shows up just to be there, whatever feelings are there. Looking at the middle of these 6 processes, we have present moment awareness, moving from the tendency the mind has to dwell in the past, the future, elsewhere, and increase the ability to stay present in the here and now. Not because the here and now is necessarily a more pleasant place always, but rather so that you're more capable of noticing what's actually happening in front of you. And that links to this concept of self as context, flexible perspective taking, where we move from being stuck in a story about ourselves, quite a rigid story often developed over time, I'm a failure, I'm a strong provider, and also rigid rule following, I must always put others first. Moving from that ends up getting applied rigidly even when it doesn't work in terms of creating a fulfilling life, and moving towards seeing oneself as the context that thoughts, feelings and sensations arise within, but not that the self is those thoughts, those feelings, those sensations, those rules, those stories. And in so doing, developing an observing self that's capable of noticing what's going on within oneself and outside. And then there's the subject of direction, values and action. Values is about moving from a loss of direction, loss of contact with what really matters to you in your life, towards awareness of what does matter and how you want to be in this world. To go back for a second, one of the rules of thumb that we might say is that a life well lived is a life lived according to your values. And then committed action, moving from being on autopilot, as we might say it, taking the line of least resistance, acting trapped, following over-established rules just because that's what you always do, moving from that towards doing what it actually takes to live life how you want to be, in accordance with your values. Even when that's difficult, whether that's physically difficult, emotionally difficult, or has challenging thoughts attached to it. And how do we do that? Well, there's a whole range of techniques. Broadly, what we're doing is identifying the stuck pattern that a person's in, recognising and helping them to recognise how that hasn't been working for them in terms of creating a fulfilling life. Noticing how their attempts to control their internal experience, get rid of unwanted thoughts, unwanted feelings, have actually made things worse in their life. Then exploring what some of the alternatives might be in accordance with the moves we've learnt about in the last few slides. There's lots of use of metaphor, lots of storytelling, visual imagery, in order to get around some of the overlearned associations and rules a person has, to come at it with a radically different angle. There will be experiential exercises within the room. There will be lots of awareness exercises, effectively mindfulness type exercises. Learning to track the responses as they happen in the room. So the therapist noticing what has happened, at what point a person has slipped into experiential avoidance or appears to be fusing, and pointing at it, commenting on it, helping the client to become more able to do that independently for themselves. There will be practice in persevering in the presence of unwanted thoughts and feelings, exposure work. There will be tasks to pursue outside of the sessions to take forward in life. And through those mechanisms, we aim to move a person from this stuck and unfulfilled life to the point where they're moving forward and have a more fulfilled life through diffusion, willingness to experience, increased present moment awareness, more flexible perspective taking on themselves and their observing self, more aware of their values, and more habitually taking committed action, even when it's difficult to do so, using all the other techniques around that hex. Just worth pointing out that although we talk about these as separate processes, actually they are all intimately linked. And sometimes the borderline between the two of them is vague and pragmatic rather than about some underlying truth. So it's worth also representing them as things that are directly linked each to the other. If you want to learn more than this very brief overview, the website to go to, contextualscience.org, home of the organisation that sort of hosts to ACT, well worth looking at. If you want books to learn skills, then the starting point is probably, I'd recommend ACT Made Simple by Russ Harris. If you want to move on from there, Learning ACT by Luoma, Hayes and Walser. If you're interested in looking at a self-help book level, the best general self-help book is, I would believe, now Activate Your Life, just come out, Oliver Hill and Morris. If you wanted to look at the application of this kind of ACT approach in one specific context, that of long-term physical health conditions, I've written a book called Living with the Enemy that just goes through that fairly systematically. And if you wanted to learn more about those behavioural basics, the underlying learning and theory, the best books I would recommend would be the ABCs of Human Behaviour or Learning RFT by Nicholas Tourniquet. I hope this very brief overview has been useful to you in either refreshing your memories of an introductory course or some introductory reading, or is useful in preparing you for a course or some further reading that you're about to go on with.